Hi, good evening. This practice is a practice to relieve sciatica symptoms, back pain, lower back pain. Sciatica is defined by pain that radiates down the leg and often below the knee, usually coming from the lower back, something being compressed or pressure on a nerve, sometimes a bulging disc or a slipping disc in the back. So we need to be very, very careful when we're working with this. If as you come into an exercise or a posture, you feel that the pain is increasing, especially the pain that you're feeling that's running down your leg, then the exercise that I'm showing you isn't for you. So you stop, you back away from that exercise, and you maybe try something different. So there isn't a one exercise kind of fits all for this. So you need to be attentive, and if your pain is increasing rather than decreasing, it's not for you. The first thing that we're going to do is a really gentle stretch. So we're coming into seated. The left leg is straight, the right leg is coming in towards you, and you can bring this leg in just a little way if you're feeling a lot of pain, if you need to be really cautious, or you can bring the leg in further if that feels okay for you. So this is very similar to a posture that we would do supine, where we hug one knee in towards the chest, just a different way of doing it. So you draw this knee in towards you, and you might feel that there's some relief, just a little bit of opening here in your lower back. You can draw the leg in a little bit more towards you. And if you just want to increase sensation here, feel a bit more opening running through the back, you can lower the head down towards the knee. And this is why I'm showing this from seated rather than from supine, but either is fine. To bring that little bit of extra flexion from supine, you're having to lift your head up, so maybe that brings a lot of tension into the neck and the shoulders. So I like to do this way and just bow the head down and towards the knee. So you can come as far down and into this, and first thing, I'm doing this in the evening. My neighbours have been power tool crazy all day, so I've been waiting for a quiet patch. But first thing in the morning, this feels like a really nice opening for me. So just trying this and dropping the head down towards the knee. If it's too much, you can lift the head up a little bit again. And just taking a breath or two there. So often our pain with strain in the back or sciatica can be caused or worsened by flexion, by forward folding. So any kind of flexion, any forward folding that you're going to do needs to be very, very gentle, no strong forward folds. So just taking another breath here. And then releasing this side. And just doing the same things to the other side. So you're bringing that leg in, just as close to you as feels okay. You can hug it in towards you. If it's too much to come around the front of the shin, you can come around behind your thigh. And just noticing how it feels to bow the head down. And just to open up through the posterior side, through the back body. Take a breath or two. Really try and send your breath into the tight spots. So notice what you're feeling. If there's any pain worsening as you do this, you know that you need to back away or come out of the position completely. Good. You can bring yourself slowly up and out when you're ready. And then in your own way, your own time, just bring yourself over and onto your hands and knees. So you come into a tabletop pose. And of course, we all know this is Madrasana or cat-cow. But very, very slowly the first time, draw the tail under and be sure that you feel that you're opening into your lower back and around your sacrum. So just posterior tilt the pelvis. A little bit of gentle opening into your lower back. Coming up and into your middle back. Into your upper back. And then bowing your head down. You can take as much time as you like there before you move in the other direction. So gently extending your spine. And gentle extensions tend to be very helpful, very good for this kind of pain. So just holding in this position for a breath or so. And then very, very slowly going the other way. So just feeling every sensation, listening to what your body has to tell you. And again. And maybe one more time. So here you're looking to feel decreasing pain and more movement, more mobility as you go through these repetitions. You can do more. You can go a little bit quicker if you feel that that's appropriate. You can link with your breath if it feels good. So you exhale as you gently flex. Yeah, and you inhale as you gently open the frontal space. So just taking as many repetitions here as feels okay for you, listening again to what your body has to tell you, the information that you're receiving, and then maybe just drop back very, very gently into a child's pose. So again, the flexion here needs to be gentle. So feel your way into it quite slowly. Make sure that feels okay for you. And then breathe into your back. Imagine that you're sending the breath into your lower back. And that as you feel the breath and the expansion in that area, imagine you're nourishing your back. You're soothing that pain. When you're ready, bring yourself into a prone position. So transition slowly. Come all the way down and onto your belly. You might just want to be very low here. So you can just put your forehead on your hands, and that might be enough. There's a little bit of very gentle extension through your spine here. So if this feels as much as you should do, if the pain in your back or the pain running through your legs is intense, then keep it here, keep it very soft. If you feel it's okay for you to come up into more of a Sphinx pose, you can come up onto your forearms. Now know that you can have less or more extension by changing the position of your arms. And for this first variation, we're going to try and soften into it. So you're not really powering with your legs, you're just trying to let your back soften and release. Now if it pinches, if it doesn't feel good, work a little bit with your legs and try and draw your tail down a little bit to open up space. But if it feels okay just to be here and soften for a few breaths, then just stay here and enjoy that position. You can close the eyes, move the breath. If you can stay for 4 or 5 breaths, that would be a nice duration. But again, really observe what you're feeling. If there's any increasing pain, then you need to back away or come out of the posture. It might not be the right posture for you. So as long as it feels comfortable, it's okay for you to stay here. If the sensations feel intense, you know you can bring yourself down. We'll take one more breath. And then relax all the way down. So you could turn your head to one side here and just take a breath into your back. That feeling that you're nourishing your back again. Maybe turn the head the other way. And then if it feels okay for you, we'll come into just a little bit of strengthening into our back. So we'll take the arms out in front of us, we'll put the forehead on the mat, tuck the chin in so the back and neck's nice and long, let the legs lengthen. And just try to start with one limb at a time. So as you inhale, you'll just lift your right arm. You can lift your forehead away from the floor, but make sure you don't thrust your chin forward and overextend your neck. So keep the neck nice and long. Just lifting the right arm as you inhale. And then exhale down. And then the left. And then down. And then the left leg. And down. And then the right leg. And now you can keep it that easy Or you can take this in diagonal pairs, so it will be right hand and left leg together. And then left hand and right leg together. Good. Again, be sure that you're really receiving the information your body's giving you. If it feels okay to do that again, right hand, left leg. And down. Left hand, right leg. And down. Good. You can do more if it feels good or if it feels okay. When it feels like enough, maybe give the hips just a little rock here. Just rock the pelvis, let the lower back soften and relax again. And then take a super slow transition into child's pose. So you bring yourself slowly up. Sometimes rocking the hips again is helpful. And you just drop back onto your heels. If it's too much to come all the way into the child's pose, you can just rest part way, or you can come all the way down and into child's pose. Good. We'll bring ourselves slowly over and onto our backs. And we'll take a version of reclined pigeon pose here. So bring your right ankle onto your left thigh and let your right hip open. Now often the tightness, the pain runs over the hips. So just a little bit of gentle opening here can feel very good. So check in again, make sure that it's not too much. You can stay here, or you can bring the legs in towards you. Now, if catching your leg is a little bit of a challenge and it tends to bunch up your shoulders, you can use a strap or a belt and come around the back of your thigh here. And you can use that belt like a sort of extension of your arms. You just want to be in the posture enough that you feel a bit of light opening around this hip and maybe into your lower back on that side. And you might again just a little rock. Notice how the sensations change when you shift. If you shift a little bit over to the left, you're sure to feel more opening, a little more intensity in your outer right hip. Take another breath. Good. Okay. Now I want to show you this because I had one student this worked really well for when he had pain in his back and running through his leg. So you put your left foot down, but you keep your right leg in a pigeon pose. So you've not really moved. Let me show you that again. You've not really moved your right leg. You've just taken hold of the right foot, and then you've put your left foot on the floor. And you want to be really gentle with this. You try and keep your thigh, your femur, in exactly the same place, but you just tease open a little bit the knee. So it's just the low leg that you're moving. You're just opening the knee a little bit more here. And sometimes that just changes the stretch that you're feeling. So that may or may not be helpful, but have a little play with it. Really listen again to what your body is telling you, the feedback that you're receiving. And just see if that little adjustment brings a nice opening into your hip and into your low back on the right side. When it feels like enough, you can release here. And we'll just do the same thing. Feel the way that softens down before you do anything else. But we'll do the same posture on the left side. So you bring the left ankle onto your right thigh. You may want to stay here. You may want to bring the legs in. You can use that belt here to hold the legs if you don't want to bring tension into your shoulders. Or that leg might come in close enough that you can comfortably clasp behind your thigh. We take a few breaths here. You feel that you're breathing space down towards your pelvis, down and into your hip. Each exhale just rinses away the pain. So again, you're looking for decreasing pain. You're looking for the pain to reduce as you breathe in your posture, certainly not increase. And you can stay in this basic posture, or you can drop your right foot to the floor, hold your left foot. Remember, you're not really moving the thigh, the femur here, that stays in the same place. And you just gently open up the knee a little bit and see how you feel, see where you feel. So you're not looking to straighten your leg. We don't have that goal. We're just opening the knee a little bit, looking for a slightly different feeling or opening into that outer hip and low back on the left side. So you can sort of tease that open a couple of times. And then when it's enough, you just release down. And again, notice how the body drops. You might just rock your legs a little side to side. So you just shift the weight across the back of your pelvis. That can feel really good. Now you can stay with this, just really tentatively light rocking movement, or you can bring yourself into a spinal twist. So we'll move the hips. If you're coming all the way into twist, we'll move the hips over to the right and we'll bring the knees over to the left. Now you might want some support, so you can use as much support, blocks or pillows, cushions underneath your legs if you need to. And you just come into a version of twist that feels okay for you. Play a little bit with the position of your knees. Sometimes with the knees lower or higher will change what you're feeling through your back. So you can adjust that to feel good. And again, if it's feeling too intense at the moment with whatever is going on in your back, you come out of the posture, you come away. Maybe you go back to just rocking your knees gently side to side. So we take a breath or two here. Again, you can stay for longer if you feel that this is beneficial, if you feel that your pain is decreasing in the posture, then you can stay for a few more breaths. If you feel ready, you come up slowly. Now use your feet here to lift firstly your right leg and then gently your left leg, both feet together, just to glide your hips back to the center. Everything very, very slow. So you can really start to feel what is good for you, what's good for your back right now, and maybe what isn't so good. So you go over to the left, the knees over to the right. Remember, support here, lots of support here if you need it. And then into your twist. So if this knee is lifting a little bit, then you need either support between the knees or underneath that lower leg. You don't want this gap here, this space. You can adjust where the feet are, where the knees are. Feel what's good, feels most comfortable. So you're not looking for the strongest stretch. You're looking for the position that brings you the most relief. And again, just a few breaths here. Coming out of the posture is very, very slow. You come back to the center here. And then we just want to hug the knees in towards us, so we just balance out the two sides again. You might drop your right leg out to the side and then draw it in towards you and in towards your center. Sometimes that feels a little easier than just lifting the leg and bringing it in. You can do the same to the other side, just let that left leg fall out, draw it up towards you, and then in. So maybe a cradle rock here, or you can circle, just very, very slowly, gently. Soothe one way and then the other way. And then just take a moment or two to relax. Now, I would say either with your feet on the floor and your knees bent, or with a bolster behind your thighs if you have one, and your legs draped over the bolster, rather than putting your legs flat on the floor. If you are choosing to have your legs bent this way, then sometimes it feels good to have a bit of support so that you can really relax your legs into a belt or a strap. So you want to find just the right space with that strap, not so that it's pulling your legs in together, but so that your legs can rest out and into the strap a little bit. So maybe just fractionally wider than your hips. Just letting the legs rest into the belt. And then you can put your arms wherever you're comfortable, either by your sides or on your belly. And just take a few breaths. And continue to feel that each time you exhale, you just release some of the tension that accumulates around the pain. That you rinse away some of the discomfort. And that each inhalation is nourishing and soothing. Certainly you can stay here for as long as you like. If your back feels freer, if your pain is less, you might want to take a really long relaxation here. When you feel ready, turn very gently onto one side, and it doesn't matter which side you choose to turn to, so whichever way feels more comfortable for you is fine. And you just take a rest there on your side, take a breath or two. And then slowly and carefully from here, use the hands to bring you back up. And just take a moment to notice again how you feel. Namaste. Thank you.